Hi, I'm Dr. Stuart Cox.
And I'm Dr. Jared Norman, and we're with Nevada Spine and Disc. We'd like to give you a chiropractic tip.
If you're experiencing symptoms of neck pain with radiating pain down into the arms or hands, numbness and tingling, as well, if you're having those types of symptoms in your lower back where you are experiencing pain into the buttock area, leg, foot, these symptoms relate to a condition that has to do with the herniation or possibly bulging discs. I've had patients ask me, are there any alternatives to surgery for having this problem resolved? And the answer to that is yes, there are. The table that I'm sitting on is a spine med table, which is a non-surgical spinal decompression, which takes the disc, the herniated disc or bulging disc, and retracts that material, taking it off of the nerve and back into the disc. If you're interested in a resolution for your problem with disc herniations, disc bulges that are causing this type of pain, numbness, and tingling, I would recommend that you find someone who has the spine med table, as it is the most advanced technology that's out there today.
80% of people will experience back pain at some point in their lives. Many people are commonly misled that going to a medical doctor's office is the only way to relieve this pain. At a medical doctor's office, you will receive pain medication and muscle relaxers. While those do a great job at covering up the symptoms that you're experiencing, they don't do anything to fix the problem, the actual problem in your body that's causing the pain. Going to a chiropractor's office, they will perform an examination, they'll take x-rays, and they'll be able to uncover what exactly is going on in your body. What is causing the pain? That's what we'll be able to find out. And once we find that out, we'll be able to perform different types of treatment to be able to correct those problems so that we'll actually fix the problem and then the pain will go away through the correction instead of just covering it up with the pain medication. They'll do all these different kinds of treatments to fix the problem so that this back pain, the neck pain, will go away and won't come back. A question I get asked all the time is, what is a good exercise for my low back? Now, after you've suffered a low back injury, I don't recommend doing exercises where you actually bend your back very much. Now, it's important to try to find exercises where your back is able to be kept almost straight. And the best exercise that I've found for that is called the plank exercise. Now, this isn't solely for the low back. It's also for the abdominals and the whole entire core muscle area, okay? So I'm just going to go ahead and show you how to do this exercise. You're going to come down, you're going to be on your elbows and your toes. So you're going to get your elbows in line with your shoulders. Start on your knees like this to make it easy to come up. And then you're just going to lift up your hips and hold it on your toes. Now, when you're in this position, you want to keep your head nice and straight, looking right down towards your hands. Don't look up and don't look down, because that'll cause a lot of stress on your neck. Okay? Another part of this of the exercise is you don't want to lift up your butt like this, and you don't want to dip like this, because that'll hurt your low back. So once again, you start up on your knees like this, and you come up on your toes, keep your body straight and your head straight ahead. All right? And that's how you do the plank exercise and strengthen your core muscles to really just stabilize your low back and keep you from having this injury come back again in the future. With this exercise, you want to be able to hold it as long as you can. Work up to where you're able to hold it for at least a minute, and that's when you know that your core muscles are much stronger.
If you've liked what you've heard and you'd like to know more, visit us at stopthebackpainnow.com.